Our next speaker is Dr. Alison Owen. So Dr. Owen is a lecturer in health psychology at Staffordshire University. After completing her undergraduate degree in psychology, she completed a master's in health psychology and subsequently a PhD investigating the impact of appearance-focused skin cancer prevention interventions. She then began working as a lecturer at Staffordshire University, combining teaching with her passion for research. Her main areas of interest and expertise are body image and health promotion, and she has authored over 30 peer-reviewed articles. And today, Alison will be presenting on the psychology of sunbed use and the potential for addiction or tanorexia.
Okay, hi everybody. So as they've just said, I'm Dr. Alison Owen, and today I'm going to be talking to you about some research regarding the psychology of sunbed use, so why we use sunbeds, and also research around tanning addiction, and then finishing off with some ideas of how we sort of might help reduce sunbed use. So next slide, please. So just to give you a little bit of background about myself, so I carried out a master's in health psychology in 2009 to 2010, and that's where my interest in research sort of related to sunbed use, to sun protection, UV exposure began. And for my dissertation for that, I carried out focus groups, just sort of talking to people about their sunbed use behaviours and thinking of ways in which we could improve that. Leading on from that, I then carried on researching and carried out a PhD. As it says here, the title was an appearance-based intervention examining the effect of electronically aged photographs of the face on sun exposure attitudes and sun protection intentions. So I'm going to talk a little bit later in my talk about what exactly I did for my PhD. But yeah, so since finishing my PhD, as the introduction said, I've carried on working as a lecturer and doing lots of research. And it says here, publishing various pieces of research in the area of sunbed use, sun protection, and sun exposure. So what I'm going to be doing today is just talking you through some of the research that I carried out that's sort of relevance to what we're thinking about and talking about today, and talk to you about some other pieces of research that are also of relevance. So if we could move on to the next slide, please. So yeah, what I'm going to start by having a think about is the psychology of sunbed use and tanning. So having a think about why people use sunbeds. So could we have the next slide? So a piece of research that I carried out sort of during my PhD was where I carried out research talking to different people who used sunbeds and you sort of enjoyed having a tan. Of the 70 female participants I interviewed and sort of carried out questionnaires for me, 20% of them had used a sunbed in the last month. And when we looked at all of the participants as a whole, 80% of them agreed that a tan looked good, and nearly 3/4 of them felt that tan people look healthy. So as we've seen from the other speakers so far this morning, actually tan skin isn't really a sign of healthy skin at all. It's actually a sign of our skin sort of trying to protect itself from further damage. So it's quite interesting that, as it says here, nearly 3/4 of people actually felt that people with a tan looked really healthy, and that 80% of them agreed that a tan looked really good. So next slide, please. So I'm a qualitative researcher. So what that means is that when I do research, what I do is speak to people. So I'll do interviews, I'll do focus groups. So the data that I collect from my participants is in the forms of written word and quotes. So what I'm going to talk you through on the next few slides is just some examples of quotes of people that I've interviewed or carried out focus groups with in the past. So this particular piece of research that I did was with British adolescents who were aged 11 to 14. And I was just basically talking to them about their attitudes towards tan skin, towards sunbed use. Got a few quotes here. The participants that I spoke to, as I say, they were between 12 and 14. They had really positive attitude towards tan skin even at that age. So we can see Ellie said, "You don't want to be dead pale." Zola said, "I hate how I'm so pale." So really, even at that young age, they're still sort of, looking at the color of their skin and thinking, nope, I want to be tanned. I don't like being pale. When we were speaking to them about sunbeds, actually I thought quite a high percentage there, really. 15% of the participants had sunbeds in their own homes or had relatives who had them in their own homes. So quite a high percentage, in my opinion. We've got a quote here that was from Virgil, who said, "No, I've not used one, so not used a sunbed, but I think they're very good. It's better to get a proper tan than use sort of sunless tanner or fake tan." So again, quite interesting, even at the age of 13, sort of starting with that positive attitude towards using sunbeds. Of the participants in this study, in the focus groups, there was 227 participants altogether, and about half of them were in focus groups. And I would say, I think it was about 15-20% of them had really positive attitudes towards sunbeds at that age. The rest either had a negative attitude or were neutral. But still, surprisingly high percentage, even at the age of sort of 12, 13, 14 years old. So we can have the next slide, please. So similar sort of study. This was looking at awareness and attitudes of sun risks and sun protection behaviours in a group of girl guides. So they were aged between 12 and 18, the ones that we interviewed. And again, really, really positive attitudes here towards tan skin. So we've got Faith, who's only 12, saying you get more attention if you're tanned. Millie saying it makes you feel better about yourself. So again, really sort of seeing it in that positive way, sort of attention, making you feel better, more confident about yourself, not wanting to be pale. Big thing when we look at reasons for using sunbeds, wanting to have a tan skin is, as Amy's quote here says, those sort of social norms. So what are the people around us doing? Are the people around us using sunbeds? Are the people around us, having tan skin? So we can see Amy said it's becoming like a social norm that you want to have a tan or that you should have a tan. So first she felt that, having a tan is something that other people had, and it was something that she felt pressure that, she should have one. Another really big thing that comes up in a lot of research in all different areas, but that I found really comes up in sunbed use, sun protection behaviours, is social media. So we've got a comment here from Blair who said, social media cultivates everything, like from your body type and body image and skin tone. So like all these social influencers and celebrities are all tanned and flawless. So a bit of a comparison there to people on social media, to these influencers and celebrities, and Blair feeling that actually when she looks at these people, on screen or on a phone, they've all got really, really tan skin. We've got Jess here who says, on Instagram and YouTube, there's always people with tans talking about holidays and this will look good with a tan, and say they didn't tan enough on holiday, they want to be darker. So again, linking to that impact of social media, seeing what other people are doing, both in terms of our friends and our peers, but also in terms of influencers and celebrities. If they're there with tans and like sort of, talking about things like tan skin, talking about how they didn't get tanned enough on holiday, then it's really adding to that pressure of sort of feeling like we should look the same and should have that tan skin rather than be more pale. So next slide, please. So a study here isn't one that I carried out myself, but it was a colleague of mine, Jennifer Taylor, who carried out this study. And she interviewed people who used sunbeds. So she was interviewing adult women. So obviously those studies I've mentioned before are more on younger women, but just to add in some from adult women. So Laura here is just explicitly saying what we sort of think of when we think of why people use a tan. So she said, I think the main reason is for appearance. I doubt anyone goes to the sunbed thinking I need to top up my vitamin D. Actually, though, from my research that I've done with people who use sunbeds, I've found that for some people that is a bit of a justification that say, well, do you know what? We don't get any sun in this country. We're meant to get vitamin D, and actually that's my way of getting it from the sunbed. So that sort of justification. But as we've heard from the previous speaker today, actually that's just sort of a bit of a myth. And it's not like you would go on a sunbed to really help increase your vitamin D. Interesting quote here from Zoe, and again linking with quite a lot of stuff that I've found, that sort of justification as to why they're using a sunbed. So Zoe's basically saying in this quote, I do know, there is a risk for something like that, but then I always think that everything's a risk nowadays. They always say, if you do that, you can get cancer. And I always think, everyone does something, like some people smoke, people drink, eat fattening foods and don't exercise. And, I try. I don't smoke at all. I try not to drink a lot. I always think that everyone's got their own guilty pleasure, and mine is going on a sunbed. So that sort of justification is something that I've come across quite a few times in my research, that with people saying, yes, I might use sunbeds, but actually I don't drink, I don't smoke. I've also found that in my other research. So I do research into other health behaviors. So I do research into people who binge drink. In the past, I've done research with smokers. And really is exactly the same, that sort of justification and trying to justify it to yourself. Yeah, I may do this one behavior that's not very healthy, but actually the rest of my life is so healthy and that's absolutely fine. But again, as we've seen from our previous speakers today, even if you don't do anything unhealthy, using a sunbed obviously is still, really risky to your health. Another quote here from Natalie that again is something that I've come across is people sort of justifying the use of sunbeds for health reasons. So Natalie talks about how she's tried topical lotions, antibiotics, tried lots of different things for her eczema, but actually nothing's cleared it up. And so for her, she feels that using a sunbed is the only thing. So a few different reasons on that slide as to why people use sunbeds. As we've seen, we've got those sort of, simple appearance things, people not wanting to look pale. We've got impacts of social norms, social media, and also people trying to justify it for health reasons. So things like for getting vitamin D or for skin conditions. Next slide, please. So a bit of an interesting study here, I felt. So it was a study that I carried out with a guy called Aaron Blashill. So he works at Harvard Medical School in America. And what we did was sort of take this data from, as it says here, 1,500 US participants. And what we did was had a look at skin cancer risk in comparison to appearance evaluation. So a massive area that I do research in is body image and how people feel about the way that they look. And we found a really, really interesting finding, I felt, in this study, that was that people who negatively evaluated their appearance, so people who felt more negatively about their appearance, people who, when they looked in the mirror, didn't like what they see, were actually at significant increased skin cancer risk. So, as it says here, they spent more hours spent outside without protecting their skin from the sun. They were much less likely to use sunscreen and sun protection. So quite an interesting finding that people who feel more negatively about themselves are less likely to use sun protection, more likely to have been sunburned. We didn't specifically look at sunbeds in this study, but going on these findings, there would possibly, I would presume, maybe be a link between people using sunbeds and people sort of negatively evaluating their appearance. A few different reasons for that. It could be that if you don't feel good about your appearance, you want to maybe try and improve it from using sunbeds. Or it might be that actually, if you don't feel good about your body and your appearance, you don't care about it and think, well, do you know what? If I get skin cancer, I get skin cancer. I don't care about my body. So quite interesting finding there. So next slide, please. So sort of another study kind of related to this is a study that I have published recently with a guy called Manpal Bogle, and he's an evolutionary psychologist. So we basically were just chatting and realized actually there was no research that was sort of looking at sunbed use from an evolutionary point of view. So with evolutionary research, a lot of it is to do with mate value, which in other words just means sort of how people feel that they, how much value they hold as a potential partner to somebody. And it says here, we found that people who have a higher self-perceived mate value, so they felt that they had more to offer a potential partner, had more negative attitudes towards sunbed use and were less likely to use a sunbed. Whereas those people who felt they had less to offer a partner, less to offer somebody, were significantly more likely to use sunbeds. So again, quite an interesting finding there. So next slide, please. So what I'm going to do now is move on to tanning addiction and just have a little few slides. I know we're running out of time here, but having a few little slides here about tanning addiction. So next slide, please. So as it says here, there's sort of a growing body of research providing just preliminary initial support for viewing excessive tanning as a behaviour with addictive potential, but it's not actually currently recognised as an official behavioural addiction. In the past, when people were looking at tanning addiction, they were sort of comparing it and using traditional substance dependence criteria. So criteria based on things like drug addiction and alcohol addiction. And they sort of don't fit in that well together. But actually, there's more sort of a body of work and a body of research trying to put forward that actually tanning is an addictive behaviour and sunbed use is actually really addictive. So next slide, please. Got an interesting study here from Harrington et al. In 2012. So we can see the pictures. These are just pictures of sort of brain scans, and these were pictures from the actual study. And what they did was they took sort of a group of sunbed users and looked at their brain activity and blood flow, sort of brain blood flow, while they were using sunbeds. And actually, they found that, I've got this little quote here, using tanning beds has rewarding effects in the brain. So people may feel compelled to persist in the behavior, even though it's bad for them. Because they found that actually the brain activity and blood flow in their participants while using sunbeds were really, really similar and setting off sort of, similar parts of the brain in people who had drug and alcohol addiction. So a really sort of quite important study here showing that despite maybe tanning addiction not fitting into traditional addiction, molds, actually when we look at the brain activity of people who use sunbeds a lot, they do show the same sort of reward centers, the same blood flow as people who are addicted to drug and alcohol. Next slide, please. Just got this little measure here, which I thought was quite interesting to add in. So this was made by Stapleton et al., who's a massive researcher, psychology researcher in sunbed use. And he's developed this behavioural addiction indoor tanning screener scale. So it's 7 items. And if someone answers yes to 2 or more of those items, then it suggests a possible addiction to indoor tanning. So next slide, please. So just to finish off, obviously we've looked at sort of the reasons why people might be, wanting to use sunbeds, wanting to have tan skin. And we've looked at the possibilities of tanning addiction. What we want to do next is think about what could we do about that? So as we can see from here, we want to try and think about changing behaviour. So as I put here, health-related campaigns can often fail to motivate young people to change their behaviour. So if you think about things like smoking, we all know that smoking is bad for our health, but that doesn't mean that people, choose to stop smoking. They still choose to continue smoking. Researchers found that many people feel that actually health-related threats are too long-term to sort of worry or concern, and they're not relevant to them. But as it says here, research by Sarah Grogan, who does a lot of research in body image, found that for a lot of young people, they're highly motivated to maintain a youthful appearance and that their appearance is a priority for them. So she carried out research with young smokers, and they basically were all saying, do you know what, I enjoy smoking. It's not something that I'd want to give up. I know it's not great for my health, but actually at the moment, I'm not seeing any impact of it affecting my health. Maybe if I started with a cough in the future, I'd stop. But what they did say was that if the smoking started to impact the way they looked, that might be what would stop them and make them think about stopping smoking. So next slide, please. So do you want to just click through a couple of times? That's it. So we can see from this slide, this is, I know one of the speakers touched on it earlier, but this is a piece of software that I used in my PhD. And it's basically a piece of software that shows people how they'll age with and without using some sunbeds, or with and without protecting their skin from the sun. So we can see the photo on the left-hand side of the screen is our natural intrinsic aging. So obviously, however well we look after our skin, we're all going to get older, we're all going to, age our skin. However, the photo on the right shows the extrinsic aging, so the added factor of using sunbeds. And we can see the difference between those. That's me aged at 72. We can see more wrinkles, more sort of sunspots and age spots. So what I did for my PhD was use this software on people between the ages of, it was 12 and 34, just to see what kind of impact they felt it might have on their future sunbed use. So if we can just click through to the next slide, please. Yeah, that's it, click a few times. So I've got a few quotes here, I'll just talk through a couple of them. So when we showed people that software, they had really sort of positive responses to it. Got a quote here from Georgina, who said, if you sort of look in between the two, so she means look in between the one where she's aged using a sunbed and one with just the natural aging, and think that just by making the effort to put some sun cream on and like not using sunbeds and stuff is going to stop that, then definitely. If with the young people, we can see Bruce, for example, saying it's maybe you want to use more suntan lotion, plaster it on before you go to school. So touchwood, really sort of potential for interventions to help people, and using sort of appearance concerns to maybe try and encourage people to choose safer sun protection behaviours. So if we just move to the last slide so I can quickly finish off, please. So just to conclude, we can see people use sunbeds for a variety of reasons, not just appearance concerns, but also things like social media pressures, social norms and people around them. There is definitely a risk of becoming addicted to sunbeds, and research has found that using sunbeds can sort of have that addictive quality. And what we want to be doing is developing interventions to reduce sunbed use and encourage safer UV exposure behaviours. Thank you for listening.